So, define disability. Teacher, teacher, don't talk. I'm teaching. Student, don't So, teach. I'm disability talking. Refers to any physical, mental, intellectual, or sensory impairment that, in interaction with various personal and environmental barriers, restricts a person's ability to participate fully and effectively in society on an equal basis with others. Disability is not only a medical condition, it is also shaped by the social and environmental barriers. It may evolve impairments related to mobility, vision, hearing, cognition, learning, or mental health. Disability becomes a disadvantage mainly when society fails to provide accessible infrastructure, inclusive attitudes, and the equal opportunities. यार ये एड्रेस मनी यार ये एक्सेल में ही मिल रही है सिर्फ क्या करूं कर ले. Explain social attitudes and stereotypes with regard to disability. They are doubly disadvantaged. Social attitudes play a major role in shaping the lives and experiences of the people with disabilities. These attitudes often come from ignorance, lack of awareness, and long standing cultural beliefs. Many of them are based on the stereotypes, which are oversimplified and incorrect assumptions about people with disabilities. Then, the negative social attitudes. Viewing disability as a tragedy or burden. So, some people think that a person with a disability is living a sad, incomplete life. They are often pitied instead of being respected. This attitude can make disabled people feel dependent and undervalued. Overproduction. Families and the community sometimes treat disabled person as if they are unable to make decisions. They are protected too much, preventing them from developing independence and the self confidence. Social exclusion. People with disabilities are often kept away from regular schools, workplaces, social events, or public activities. Society may assume they cannot participate, which leads to discrimination, blaming, or the moral judgment. In some cultures, disability is wrongly linked to past sins, fate, or punishment. This belief led to stigma and shame, especially for women with disabilities. Common stereotypes about disability. People with disabilities are the helpless. This stereotype assumes they always need help and cannot perform daily activities. It ignores their capabilities and skills. Disabled people cannot work effectively. All disabilities are visible. Okay. And disabled people are dependent on charity. Disabled people cannot marry or have families. Effect of negative attitudes and stereotypes. Low self esteem and lack of confidence among persons with disabilities. Social discrimination and exclusion. Limited access to education, employment, and public spaces. Violation of rights and opportunities. Reinforcement of inequality and marginalization. The need for the positive and the inclusive attitudes. So, treat disabled person with respect and dignity. Focus on abilities rather than limitation. Remove social and physical barriers. Promote inclusive education and employment. Statics such as the loss of limb due to a progressive disease person's condition. Unit 9. Explain indicators of reproductive health. Reproductive health refers to a state of complete physical, mental, and the social well being in all matters relating to the reproductive system. To assess the reproductive health status of a population, several indicators are used. These indicators help governments and the health organizations plan policies, improve services, and detect areas of the concern. The maternal mortality rate (MMR) refers to the number of women who die due to pregnancy-related causes per lakh live births. A low MMR indicates better reproductive health services due to pregnancy, safer deliveries, and the better antenatal and the postnatal care. Then we have the infant mortality rate. IMR measures the number of infants who die before completing 1 year of age per 1,000 live births. It reflects the quality of the maternal health, nutrition, and medical facilities available for the newborns. Then we have the fertility rate. This includes top fertility rate, the average number of children a woman is expected to have in her reproductive years. A lower uncontrolled TFR indicates better family planning awareness and reproductive health services. Contraceptive prevalence rate CPR, which measures the percentage of couples or individuals using any method of contraception. Uh, High CPR shows good access to family planning information and services. Then the age at marriage and age at the first birth. Early marriages and the teenage pregnancy are associated with the higher health risk. Higher average rate at the marriage and first birth indicate improved reproductive awareness and empowerment of the woman. Then the access to maternal health services. This include antenatal care, ANC visits. Then the skilled birth attendance, postnatal care. The nutritional status of women. Indicators such as anemia level, BMI, and the nutritional deficiencies affect pregnancy outcomes. Better nutrition reflects stronger reproductive health. And the prevalence of the STIs. Lower rates of STIs, including HIV/AIDS, indicate good reproductive health awareness and access to preventive measures. Then the adolescent reproductive health indicators. These include teen pregnancy rate, knowledge of reproductive health, access to menstrual hygiene. These indicators show how well young people are informed and supported. Then the gender equality and the woman's empowerment, access to education, decision making power, and control over reproductive choices are the crucial social indicators of the reproductive health. Then we have the availability of the reproductive health infrastructure, the presence of hospitals, community health centers, trained staff, emergency obstetric care, and reproductive health programs strongly influences reproductive health outcomes. Explain the criticism of reproductive and child health policy. Shut up. Reproductive health and rights. So, criticism of reproductive and child health policy (RCH). Reproductive and the RCH policy was introduced in India to improve maternal, child, and the reproductive health through integrated services. Although it has contributed to progress, it has also faced several criticisms. Overemphasis on the population control. The policy is often criticized for focusing more on the reducing fertility rates rather than ensuring holistic reproductive health. Many initiatives still indirectly promote contraception targets instead of prioritizing women's health and rights. Limited focus on the women's autonomy. RCS programs often fail to address women's lack of autonomy in reproductive decisions. Social issues like the gender inequality, patriarchy, domestic violence, and lack of decision making power receive insufficient attention. Inadequate quality of healthcare services. Although RCH aims to provide comprehensive services, problems persist. The shortage of the trained medical staff, poor infrastructure in rural areas, insufficient emergency obstetric care, inconsistent availability of the medicines and equipment. This reduces the effectiveness of the policy. Urban, rural, and the regional disparities. The impact of RCS services is not equal across India. Rural tribal and the backward regions lag behind due to poor access to health centers, lack of transport, cultural barriers. This creates uneven outcomes across states and the communities. Inadequate focus on the adolescents. These reproductive needs of the adolescents, such as sex education, menstrual hygiene, and awareness of STIs, are not fully addressed. Many programs focus mainly on the married women, ignoring unmarried youth and the boys. Weak monitoring and the implementation. Policies often remain strong on the paper but weak in practice due to poor monitoring system, lack of regular evaluation, misreporting or the underreporting of data, fragmented coordination between central and the state health agencies, and neglect of the men's involvement. Reproductive health is often seen as a woman only issue. RCH programs rarely involve men in the family planning, child health, the limits the success of the policy. Limits addressing of social determinants, poverty, malnutrition, child marriage, lack of comprehensive sexual and reproductive rights perspective, safe abortion access, protection from gender-based violence, informed reproductive choices, insufficient public awareness. Reduce stigma, encourage early health seeking behavior. As a result, many people remain unaware of the available services. While the RCH policy has contributed to improvements in the maternal and the child health, it is criticized for its limited coverage, weak infrastructure, lack of gender sensitivity, urban rural imbalance, insufficient adolescent focus, and inadequate monitoring. To be truly effective, it must adopt a rights based, comprehensive, and inclusive approach. Criticism of reproductive child health policies. Overemphasis on population control. Several criticism. Limited focus on women's autonomy, inadequate quality of healthcare services, urban rural regional disparities, inadequate focus on adolescents, weak monitoring and implementation, neglect of the men's involvement, limited addressing of social determinants, lack of comprehensive sexual sufficient public awareness. Define reproductive health. Reproductive health refers to a state of complete physical, mental, social well-being in all matters related to the reproductive system. It means that the people are able to have a safe and satisfying sex life, the capability of to reproduce, and the freedom to decide if, when, and how often to have children. So, reproductive health also includes access to safe, effective, and safe pregnancy and childbirth services. Prevention and treatment of reproductive infections and STIs. Access to accurate information and healthcare, protection of reproductive rights, and the bodily autonomy. PUA. Uh, the RCH program introduced the target free approach to family planning and framed the POA for India accordingly. The right of couple and individuals to decide the number, timing, and space of their children. Reproductive health. What are the important points on the reproductive health placed before IPCD with regard to the program of action? International Population Conference IPCD. International Important points on reproductive health at IPCD, International Conference on Population and Development. It is ICPD, no? So, the International Conference on the Population and Development (ICPD), held in Cairo 1994, marked a turning point in global population and reproductive health policies. The program of the action emphasized reproductive health as a key development goal, shifting focus from population control to people centered approaches. Reproductive health has a fundamental human right. Access to reproductive health services is a basic human right. Individuals have the right to decide freely and responsibly about reproduction. The program of action recognizes reproductive health as essential for gender equality and empowerment of women. Then the integration of family planning with health services. Family planning should be voluntary and coupled with the health services, including safe pregnancy and childbirth, maternal and the child health care, prevention and treatment of sexually transmitted infections. Focus shifted from merely reducing fertility to improving health outcomes. Adolescent reproductive health. Third is the special attention to youth and adolescents, ensuring access to reproductive health education, counseling, contraceptive information and services. The aim reduce teenage pregnancies, unsafe abortion, anesthesia among young people, reduction of the maternal and infant mortality. Strategies to lower maternal and infant deaths by improving skilled birth attendance, emergency obstetric care, prenatal and the postnatal care, the empowerment of women. Emphasis on women's education, decision making, and control over reproduction, linking reproductive health to gender equality and women's status in society. Then we have the comprehensive sexual and reproductive health services. It includes family planning, safe abortion where legal, management of reproductive tract infections, infertility treatment. Services should be accessible, affordable, and culturally acceptable, voluntary, and informed choices. Emphasis on informed consent for all reproductive health decisions. No coercion in family planning programs. Clients should have access to accurate information to make choices. Addressing social economy and culture determinants, poverty, education, gender norms, male involvement, international cooperation and monitoring, which is the IEC. उनके अंदाज करम. Right to legal or safe abortion, right to birth control. What is enumeration? Double burden. Yeah, if I judgment just mentioned.